Hi, I'm Amy, and this presentation is about how bright lighting affects workplace fatigue. Environmental assessments are essential to the practice of occupational therapy. Occupational therapy models acknowledge the complex interplay of an individual engaging in occupations within their environment. Every task is context dependent, and a comprehensive environmental assessment ensures occupational therapists create a complete picture of how an individual is functioning. Engagement in occupations can be directly influenced by a person's physical environment. It's been well documented within the literature that office layout, indoor plants, and views to the outside all enhance how office workers cope with stress or mental fatigue. A 2013 study found a direct link between exposure to more intense light and feelings of vitality during daytime and in everyday situations. It found that persons who were exposed to more light experienced higher feelings of vitality. This effect was greater in the morning and during times when participants experienced relatively low vitality. These effects were felt with acute exposure to bright lighting. This study found that with exposure to bright lights, participants felt less sleepy, more vital, and happier. This was especially true for individuals experiencing mental fatigue. Participants who felt fatigued and were then exposed to bright lighting reported subjective feelings of sleepiness and vitality close to those of their rested counterparts. Past literature has yielded mixed results about whether lighting affects functional performance. Recently, more thorough methodology has been employed to explore the impacts of bright lighting. This study compared the cognitive function of participants while exposed to either halogen or blue lighting. Results indicate that exposure to blue light enhanced participants' abilities to perform multiple tasks simultaneously and make fewer errors. These tasks were performed after being exposed to blue light or halogen lighting for just 20 minutes. The authors state that the duration of this enhanced cognitive function was not measured. A 2012 study found the effects of a higher luminance level on task performance was dependent on the duration of the exposure. It found that brighter lights positively impacted task performance, but these effects were most pronounced towards the end of a 1-hour-long phase of testing. Neuroimaging studies have explored how light exposure modulates the responses of different areas of the brain. Across studies, blue light exposure resulted in the activation of areas of the brain involved in alertness, such as the brainstem, hypothalamus, and thalamus, areas of the limbic system, such as the amygdala and hippocampus, and areas of the cortex involved in executive functioning and visual spatial abilities. The results of these studies may have implications for occupational therapists assessing workplace fatigue. This study found that office workers exposed to blue and rich white lighting reported increases in their perceived levels of alertness and performance, as well as reported improvement in sleep quality at night. Occupational therapists should include lighting in their environmental assessments when working with people who experience workplace fatigue. This may have implications for many settings such as offices, hospitals, schools, and long-term care facilities. These studies can also be applied to home environments, including knowledge about sleep. Here are some considerations therapists should keep in mind when putting research into practice. First, one study found that participants who were not feeling fatigue prior to light exposure reported that bright lighting was less pleasant. Second, there's no data specifying optimal dose or duration of light exposure, but the trend seems to be that immediate exposure enhances vitality and alertness, while more prolonged exposure seems to enhance performance. Third, the effects of bright lighting primarily impacted individuals experiencing sleep deprivation or mental fatigue. And last, although research is still limited, it's worth monitoring because of its obvious practical application to occupational therapy practice.